Presentation of dialogue on Idaho Public Television is made possible through the generous support of the Laura Moore Cunningham Foundation, committed to fulfilling the Moore family's legacy of building the great state of Idaho.
Sometimes to solve a problem, you have to rethink your approach. If you want to stop child abuse and neglect, maybe we should start by strengthening families. We'll explain what that means and what you can do to prevent child abuse and neglect. Stay tuned. Dialogue is next. Hello, I'm Joan Cartan-Hansen. Thank you for joining us here on Idaho Public Television, on the World Wide Web, and on public radio stations. As much as we'd like to think strangers are the villains who commit child abuse, the reality is more than 80% of abuse and neglect happens within a family. There's a new movement that suggests we need to rethink our approach to how we prevent child abuse and neglect. The Strengthening Families movement is a part of a national effort to integrate prevention methods into existing programs. Judy Langford is a senior fellow at the Center for the Study of Social Policy and is in Idaho speaking to the Idaho Children's Trust Fund about the Strengthening Families movement. She joins us now to explain more about this movement. Thank you. Appreciate you being here.
You're welcome. Happy to be here.
Well, let me start. Child abuse is one of those topics that is very difficult to talk about, and some people, may tune away because it's a tough topic, but it's one that's important to talk about. So as you begin this, how do you bring people into the discussion so that they realize the importance of talking about child abuse prevention?
Well, our work around child abuse prevention is really focused on the youngest children. And one of the most important things to realize when you look at all the statistics, there's lots of things that'll be really scary about whatever it is. But children 0 to 1 are the most likely to be abused or neglected and the most likely to die from abuse and neglect. And as children grow, the risk goes down. So focusing on those very youngest children is something that Strengthening Families started to do from the very beginning. I think another thing to keep in mind is we usually use the term child maltreatment.
Because abuse and neglect.
Well, in our heads, when you say child abuse, it's some really horrible physical abuse or sexual abuse, and those things do happen. But they're a very small proportion of the maltreatment that happens. About 70 or 80% of all the child abuse reports are for neglect, not for actual physical abuse. And a lot of that neglect is just from parents not knowing or not being able to care for their children appropriately. So that's a huge part of what we're trying to deal with in Strengthening Families.
We'll talk about what is Strengthening Families.
Well, Strengthening Families started as a brainchild of the Doris Duke Charitable Foundation in New York. And the Center for the Study of Social Policy, where I work in Washington, has always done a lot of work around child welfare issues and things like that. And Doris Duke Foundation came to us and said, we want to have an all-new approach to child abuse prevention. And it has to be national, we have to reach millions of children, it has to be all these things. And we thought, wow, everybody's been trying to figure that out. How are we supposed to start down that path? But they really challenged us to start to think about it differently. Not the traditional ways of dealing with child abuse or having a child abuse prevention program was trying to figure out who's a likely child abuser and then try to get them to come to a parent training or to some group or even a home visit or something like that. And nobody likes to be labeled as a potential child abuser.
No one wants to be at risk.
No one wants to be labeled at risk. So we started, and especially when you're working with the youngest kids, nothing's happened so far. So what you try to do is to find ways of putting opportunities out there for families from the very earliest days of their child's life. And everybody needs that kind of support, no matter how great you are. I think anybody who's ever had a screaming baby knows exactly. You don't always know what to do. So we started to look at where do families go already, not where are you trying to attract them to go to some specialized program. And once we started down that path, it just opened up so many other possibilities about the many different places where where everybody could be much more aware of supporting families with young children and reaching out to give them a helping hand at a time that they need that. So that's what Strengthening Families is about now.
So one of your focuses is getting special information to child care providers, because that's where in Idaho about 60% of children 0 to 5 are in child care at some point.
Right.
And so that's the key. That was where you started?
Well, that was where we started. I always say it's sort of the Willie Sutton approach. It's, well, if you were going to have impact on millions of children under 5, where would you go? Willie Sutton was the bank robber.
That's why do you rob banks? Because that's where all the money is.
Because that's where the money is. Why did we start with early childhood programs? That's where a whole lot of the kids are. And it was quite an experience to go and think about those early childhood programs. We're moving into family child care providers now, but in the early days we looked at early childhood center-based programs to try to figure out what do they do for families. We know a lot about what they do for children, and there's lots of research that gives us lots of information about the great return on investment you get, the great advantages that children have who attend early childhood programs. But there were a couple of people, but not very much information about what happened to families because they participated in an early childhood program. But one of the early clues that we had was some research that a guy named Arthur Reynolds has continued to do over many years in one of the really great early childhood programs, the Chicago Child Parent Centers. And he found that at age 17, the child abuse rate in the families of those children who attended that program was reduced by 52%. And this was a gold standard research study, so it really helped us start to look at what is it about those programs that would create that kind of opportunity.
So what do you do? What did you finally distill it down to?
Well, there are all kinds of, we did a 2-step process. In the first place, we collected all the data that we know from lots of research about what makes families work well, what's right about families, not just what are all the possible risk factors, but what do we know about what makes families successful. And we wanted to be sure that we were drawing a line to the result of a reduction in child abuse and neglect, but those same factors are the same factors that create children's success in school, a much better family climate, all of these other kinds of positive things. And in a way, preventing child abuse is sort of the floor. At a minimum, you want to reduce the maltreatment of children. But where you really want to go is optimal development, the best possible start that you can give to young children. So all of these factors that we looked at from the research was where we started. And it took us 2 years of working with all the national advisors. We argued and put everything together and really came up with a framework that has been really more of the change across not only child abuse prevention, but a whole host of other ways that people think about how they support families and young children.
Can you give me an example of one thing you asked child care providers to do to help strengthen families?
What we found after we figured out what the goal was, what are they trying to do with these families? They're trying to build these protective factors. And how they do it is a whole host of different ways. And we went and looked at these excellent programs. Of course, we learned the most from the parents who bring their children,
right,
not necessarily from the staff. And the staff didn't always recognize that what they were doing every day and what they do was so important to families. And there are 7 different strategies that we identified. And one starting point is that you just value and respect parents. And you kind of know when you go in the door of a place that's really good at that, that parents are really welcome. And people say to you as you go in, we're so happy you're here today. You're doing such a great job with your child, and here's all these other things that we can do. But just valuing that role and not acting like, well, we're the experts on early childhood and we know everything about these children, but really giving parents the right place for them to be that.
your research came up with 5 different protective factors that, and let me list those. They're the factors that came up. The first one is parental resilience, social connections, knowledge of parenting and child development, concrete supports in times of need, and children's social and emotional competence. So let me ask you, they're very vague statements, but important. So let me tell you, what is parental resilience?
The resilience, what we really did, and as we start to talk about this with people who work with children and families in any way, or people who run Sunday school programs, or people who run after-school programs.
Because all of this can be be taken to any other.
Absolutely.
Right.
And all of these, in a way, this is like common sense is validated by research. And in the beginning, we said, well, this is sort of like the DUH initiative. Well, yes, everybody knows that parents need to feel like they can make it. And I think what we know is everybody's challenged. There are all kinds of things that happen in any family, whether that's someone gets sick, somebody loses their job, a relative dies. I mean, there are all kinds of things that happen all the time. When the parent feels like they can deal with that, it may be hard. It's not that it makes it any easier, but that they have confidence and they have some resilience to kind of get through that. They don't have to do it all by themselves, but just that they have that, they communicate that to their children and they communicate that to the other family members.
So a daycare worker could be someone who they could talk to, so that there's
Absolutely.
someone they could share that problem with or brainstorm with.
Well, I think the other role that early childhood programs can play for parents who are more tentative and who themselves didn't necessarily have a great family background, that early childhood provider can be really important to them to help them feel like they can make it through the 2-year-old who's driving them crazy.
We'll talk about social connections.
Well, this one is really duh. Well, one of the biggest risk factors for anything is isolation. And we know that, especially if you move to a new place, away from your extended family, from the friends that you've had, and you've got to find your own next network. And especially for the parents of young children, you've got to have somebody who's you can trade baby clothes with, who you can trade babysitting with. You can trade some babies. There's all kinds of ways that our friends really help us a lot. And they're our best network to where do I find a dentist? Where do I find, any of these things. But those connections, and there's lots of research that tells us that. One of the things we say to early childhood programs about the social connections, if you begin to think about something like a potluck dinner, every school on earth, every church on earth, every early childhood program has a potluck dinner. But if you take that opportunity of that potluck dinner to make sure that you connect somebody new, somebody who's a little isolated, somebody who doesn't know other people very much, with somebody who does. Oh. That's a critically important thing for that family. And there are lots of ways to use things that are already going on in a much more intentional way that helps build factors like social connections.
The next factor is knowledge of parenting and child development. That was a big thing my child care provider helped me when I had my daughter, my first child. It's a big task, and it's not one that's necessarily taught in school.
Well, one of the parent groups, there are many parent groups around the country who've taken this same research and said, we're going to figure out what we need to do to strengthen our capacity to be good parents for our children. And they call this one part natural and part learned, which is a really good way to say parenting isn't all natural. You want to do a good job, but there's a lot of information that you really need to have. And parents will say, even between the time that my first child was born and the time my second child was born, there's so much more information. And the sources of that information are it's all out there somewhere. But how do you get that and really begin to use it?
Last one, concrete supports in times of need. Now, this may not be something I think that a child care center can provide, because that sounds like I need I need a car to get to work so that I can afford to pay for my child care, or I need my child care covered if I'm at low income, and sometimes even not low income.
Right. Well, I think the concrete support, and this again was part of the research about what do we know about what families really have got to have. And interestingly, child care programs can, and other kinds of programs do play a role in making, they don't provide that car, but they may be able to help that family find a way to get that car or to get transportation. And what we found, of course, 1,000 stories of how early childhood programs rally around a family that has a crisis, a fire in their house. And in these days, there's lots of people who lose their jobs. There are people who are really struggling to stay in their homes. And even though a program may not be able to provide that, they certainly provide a network of other kinds of resources that help families get there. There's another aspect to the concrete support that's really important too. And we know this is also common sense, but there's a lot of research that backs this up. When families have a crisis with somebody in the family who is abusing drugs, when somebody has a mental illness, when there's domestic violence going on, those are crisis situations in a family. And people have got to have access to and have a way to get from where they are to appropriate services that are going to really help them. And again, a program doesn't provide that, but they can be a real advocate and a real link and a real bridge for a family to get to the help that they really need. So there's two parts to that. One is just those basic needs that have to be there, but the other one is those kinds of crises in a family that are really going to disrupt things without some help.
And the last one is children's social and emotional competence.
This one's kind of interesting, and you can imagine as we were constructing this framework and arguing with all the researchers, and this kept coming back as something that was really important. And it goes back to some of the data about the youngest children are the most likely to be abused or neglected. Children with special needs are more likely to be abused or neglected. Children with challenging behaviors. When children develop normally, they begin to have this conversation and this relationship and this social connection with anybody who takes care of them. When that development's not going exactly right, it's much more difficult for that adult, for the parent or the caregiver to have that connection with that child. It's very important for everybody to be paying attention to that social and emotional development of the child, so that if there is a disruption in that, you begin to facilitate that in every way that you can, because it's so important to the child's development as well as to the relationship between the caregiver and the child. And one of the cool things that we found in the early childhood programs was all early childhood programs have ways that they facilitate children's development. But the ways that children took home what they learned, the parents told us all about. Parents would say, you know, my 4-year-old came home and said, "Mommy, you look like you need a timeout." My 3-year-old said, "Use your words."
That's right.
You know, these ways that children are learning how to get along with other people or how to regulate their own behavior is something that's important at home too.
Right.
And that it's really a focus on that relationship, sort of that dynamic between parent and child that really refers to.
You've said it several times that this is all kind of common sense
It's
stuff.
totally common sense.
And now there's a step between common sense and actually getting people to do it, to actually provide those services. How are you going to take that next step to make sure that child care providers have the training that they need and the services and the backup that they need to do this? And how do you then move it into church groups, or move it into the neighborhoods, or into public schools for younger siblings? And
it's been an interesting process. And Idaho is a really great example of how a state or how a group of people take those ideas and really go with it. We're sort of like wonks. We think up stuff, we do research, we go around and talk to people, we try to make it make sense to normal human beings. But we're not a membership organization. We don't have a big national network. So what we did was begin to go talk to some national partner organizations. One of them was the National Alliance of Children's Trust and Prevention Funds. And the Idaho Children's Trust Fund is a member of that. There are trust funds in every state. They receive money from the federal government and from other sources to prevent child abuse and neglect. And we started to talk to them about how to reframe and approach the whole notion of child abuse prevention a little differently, and begin to work with early childhood programs, which they had never worked with before. Another one of our partners nationally was the National Association for the Education of Young Children. And Idaho has the Idaho Association for the Education of Young Children. The national NAEYC, as a result of our sort of bringing all this to light, changed their accreditation standards for all early childhood programs. They accredit excellent early childhood programs around the country. So now there's a section around family and community that's a part of the mission and the quality of an early childhood program. So those were two of our early partners. United Way of America is another partner that has just joined recently and who will be training all of their affiliates and working with the business community to understand this aspect of preventing child abuse and neglect through building healthy families for everybody, but taking special care to make that happen. Now, one of the things that happened in Idaho, and I live in Illinois now, I work with people all over the country, and they are importing people from Idaho to do training in Georgia, in New Jersey, and in Illinois, and maybe some other states that I don't know about yet. But what Idaho did was create a partnership with the Children's Trust Fund and the Idaho Association for the Education of Young Children, and begin to look at how do we create the kind of training that early childhood programs need, not to completely undo what they do, but to be more intentional about it, to add some things, to have more capacity to have some of those conversations with families that aren't necessarily so easy to have in some cases. And there's now a 17-hour training that is slowly making its way all around the state of Idaho, and incorporating into the quality rating system here. Not every state has sort of a different way that they do it, but to begin to say this is part of the role of an early childhood program, to pay attention, and to pay attention to families and to support the children that you're there to support anyway. And here's some better ways, some interesting ways to make that happen.
Yeah, there are 52 programs, I understand, in the state of Idaho. Now, Idaho doesn't necessarily have statewide licensing, at least not yet, but so it doesn't necessarily mean the center's accredited, but at least they're taking on that as a part of their treatment and their way that they approach how they help raise kids.
And I think the other thing, this idea, we had no idea that this idea would be adopted as it has been. There are 30 states that have leadership teams that are working across a variety of different agencies to implement that in their own way. And nobody's made any rule that you have to do that. But it's by not having a model. There's not one prescribed model. There's not a regulation that says you have to do X, Y, Z. But it's a way of presenting, this is what we know. This is what we know is helpful to families. And people everywhere who work with kids, they want to do a better job. They need better information about how to do that. And so they've just taken it up. Those 52 programs didn't do it because the government said they had to. They did it because they really want to do a better job.
If there's someone who runs a center that's not currently part of that pilot project, or if there's someone who takes care of Sunday school, or someone who works with youth groups, and they want more information, where should they go?
We don't know how to keep things to ourselves, so we put everything on our website.
Right.
And it's
and there's a link to your website from idahoptv.org on our dialogues page.
And it's strengtheningfamilies.net is the website. It's all one word, strengtheningfamilies.net. There is also, in the early days of this, we learned everything that we know from early childhood programs themselves. And there is a program guidebook that has in it, and there's also an online version. We did it once, and so many people were using it, it crashes, so we're having it reprogrammed. So I just want to be sure that nobody goes on there. It is a good thing. But what we did was put together a self-assessment for programs. You can get the self-assessment, you can download it, you can use it online. It's a part of the guidebook. You can buy the program guidebook from us. We just sell it for what it costs to print. You can download it, but
for free,
it takes
takes a little while, yeah.
And it's not exactly for free because you're paying for all the pages. So, but anyway, the self-assessment is a good place to start, and it gives people an opportunity to kind of look at everything that they do, and see. All programs are doing something that's in that self-assessment, but it gives people an opportunity to think about what else could we be doing, or wow, we never thought about doing this, or the next time we have that potluck, we're going to use it in these certain kinds of ways. So,
is this doing now what you thought it would when you first started?
We had no idea, and I guess one of the most interesting things is, the Doris Duke Foundation gave us some money, and we discovered that this might be a promising thing, and that 97% of the early childhood people in the country wanted to do a better job with kids and their families. They wanted to prevent child abuse. So it just kind of grew from there. And now there's many, many millions of dollars going into helping to spread this information and this idea. People have taken up that protective factors framework and adapted it and used it in their own way. One of the most interesting things has been the way parents have taken it up. Because originally, we had this little idea, and people started saying, well, can't we do this? And can't we do that? And everybody needs to know this, and we need to be spreading this around. So,
well, thank you for spreading some with us today. I appreciate that. Judy Langford, I appreciate you taking the time.
You're welcome.
If you want more information about strengthening families or other information, we have lots on our website. Go to idahoptv.org. And by the way, we're now on Facebook, so search for Dialogue on Idaho Public Television and become a fan. Thanks for tuning in, and join us here next time for Dialogue. So now we...
Presentation of Dialogue on Idaho Public Television is made possible through the generous support of the Laura Moore Cunningham Foundation, committed to fulfilling the Moore family's legacy of building the great state of Idaho. To order a copy of this program from Idaho Public Television, call our toll-free number or visit us on the World Wide Web.